If you've recently undergone gallbladder removal surgery or if you are considering it, you may have questions about what to expect during your recovery. While the procedure is quite common and generally safe, the body does go through some adjustments without the gallbladder. Here's a look at some common symptoms people experience after gallbladder removal and tips on managing them. Your gallbladder stores bile, a substance produced by the liver that helps break down fats. Without a gallbladder, bile is still produced, but it continuously trickles out of the liver and into the small intestine, instead of being stored and strategically released after a meal. When we don't have a gallbladder to manage the timed release of bile, it can make digesting fatty foods more difficult and may lead to symptoms like bloating and indigestion. Many people find that these symptoms are alleviated by eating smaller meals. Taking bile salts together with choline before a meal can also be a good support for gas and bloating. It's not uncommon for gallbladder removal patients to experience a change in bowel movements, either becoming constipated or experiencing diarrhea after eating. Constipation is often caused by the slowing down of digestion that results from inadequate bile flow. Conversely, when a large amount of bile enters the intestines all at once, that will cause the intestines to flush, or what practitioners often call the dumping of undigested food from the intestines, leaving you running for the bathroom. Feeling nauseous after meals, especially meals high in fat, is another symptom some people contend with post-surgery. Your body is learning to adjust to the changes in how bile is released into your digestive system, and for some, this process can result in nausea or a general feeling of being unwell after eating. Taking a dropperful of FOS formula in a few ounces of water is an excellent way to curb the nausea that may arise after gallbladder removal. While most people recover from surgery fairly quickly, mild pain or discomfort in the upper abdomen or around the surgical site is common after the procedure. People often say the sensation is like a pinching or a rubber band being pulled tight. This soreness or pinching usually improves over time, but some people do experience ongoing discomfort for months or even years after surgery. This can be caused by adhesions or scar tissue left behind from an inflamed gallbladder or from the surgery itself. The good news is these adhesions don't have to be permanent. Studies have shown that taking serrapeptase, an enzyme that can help dissolve scar tissue, can be supportive for reducing that pinching sensation and by administering castor oil packs to your abdomen. In some cases, people experience what's known as post-cholecystectomy syndrome. This is a collection of symptoms that can mimic gallbladder issues, including abdominal pain that can feel similar to a gallbladder attack. The problem people run into is thinking that they can just remove their gallbladder and then go on making the same dietary and lifestyle choices as before. What they don't realize is that the core issue with gallbladder symptoms is not the gallbladder itself, it's the bile. When bile becomes thick and sluggish, it forms stones which not only cause problems for the gallbladder, they can also get stuck in the bile ducts of the liver. This can cause acute pain for people who have had a cholecystectomy, but this time there's no organ that can be removed, you just have to work on the bile. Wouldn't it be better to address your food and lifestyle choices before getting yourself to this point? While we do have supplement kits that provide targeted support for the various stages of gallbladder removal surgery, it's important to note that most of the information you will find on this website and most of our supplements are equally important for people who still have their gallbladder and for those experiencing after gallbladder removal symptoms. It all comes back to the bile. The food and lifestyle choices that are supportive to creating healthy bile before surgery are also supportive for your bile afterwards. While gallbladder removal is a common surgery, the recovery process is unique for everyone. It's normal to experience some digestive changes, discomfort, and fatigue as your body adjusts. Most of the symptoms improve over time, but if you find that they persist or worsen, Don't hesitate to reach out and schedule a consultation.